Good afternoon. Good afternoon. Good afternoon. Welcome to the School of Public Health graduation celebration. My name is Juanita Ricks, and I am the Assistant Dean for Students for the School of Public Health. Thank you to members of our faculty and staff and our wonderful students whose efforts made this celebration possible today. Family and friends of our graduates, I'm so happy that you are here to witness and celebrate these graduates in person. It is surely because you were invited because someone in this graduating class values you immensely. We are about to have our commencement of faculty led by our dean, but I do need to mention that in process is a rescue of a portion of our faculty who are stuck in an elevator. They will join in process. Now, please join me in welcoming the School of Public Health Dean, Dr. Hillary Godwin, as she leads the procession of our faculty. Dean Godwin is accompanied by our graduation speaker, Myra Parker, Associate Dean for Education, Elizabeth Kirk, Associate Dean for Faculty, Stephanie Farquhar, Assistant Dean for Research, Helen Chu, Interim Department Chair for Biostatistics, Ali Shojai, Department Chair for Environmental and Occupational Health, June Spector, Department Chair for Epidemiology, Karen Edwards, Department Chair for Global Health, Heidi Van Nuyen, Department Chair for Health Systems and Population Health, Megan Ramaswamy, also program directors and other members of the faculty of the UW School of Public Health. And now, please join me in giving a very warm welcome to our School of Public Health graduates for the class of 2025-2026. They are already seated. Thank you, everyone. Please join me in welcoming Dr. Hillary Godwin, Dean of the UW School of Public Health, to the podium.
Good morning and welcome. I am delighted to be here and to open the 2026 University of Washington School of Public Health graduation celebration. I begin today's ceremony by acknowledging the land that we are on. The University of Washington acknowledges the Coast Salish people of this land, the land which touches the shared waters of all tribes and bands within the Suquamish, Tulalip, and Muckleshoot nations. Today is a joyous occasion. We are graduating 898 students this year. Woo! '91 with doctorates, 284 with master's degrees, and 523 with bachelor's degrees. of these graduates are overseas, and some are already at work in their new careers, but most are with us here today for the celebration. I also want to acknowledge that this has been an enormously challenging week for us in the School of Public Health, and that not everyone that we wished would be here to celebrate is here with us today. And I recognize in saying so that there are probably many of you out there who had loved ones that you hoped would be here today to witness your great accomplishments, graduates. And so I was hoping that we could just take a moment of silence for all the people who contributed to the great success of our graduates here today, but weren't able to be here with us. Thank you. Today's graduates will carry the public health torch for the next generation. They continue the essential mission of protecting the public's health, peace, and prosperity. Public health is the science and public service of preventing illness, injury, and disease for both populations and for individual human beings. The professionals graduating today are prepared to work with communities locally and globally to protect and improve our shared health. University of Washington public health graduates are globally respected for the impact that they make during their education. The graduates here today have worked with communities across the globe to prevent disease, make our food, water, air, and environment safer, improve health policies, services, and care, and use highly advanced technology to solve what was once impossible. But remarkable graduates don't just form themselves. It truly takes a village to grow ambitious and dedicated public health leaders. I extend a special welcome to the friends and families of the graduates whose love and support were essential to the graduate success. If you are here supporting a graduate, I invite you, as you are able, to please rise and wave. And I encourage everyone to applaud these loved ones who make our success possible. Now, please join me in welcoming Dr. Elizabeth Kirk, Associate Dean for Education for the University of Washington School of Public Health, who will introduce our fantastic student speakers.
Thank you, Dean Godwin. First of all, I want to add my congratulations to all of our graduating students and my appreciation to everybody who's here to help us celebrate. So well done, everybody. Every academic year, the environmental public health, the health informatics and health information management, the public health global health, and the food systems nutrition and health majors each select an outstanding undergraduate student to be honored for exemplary scholarship and dedication to the practice of public health. This year's undergraduate student speaker is Daphne Suen. Daphne Suen is an exceptional scholar and leader, graduating magna cum laude with degrees in public health, global health, and biochemistry. She is dedicated, compassionate, and committed to equity, with high-impact roles as a student resource coordinator and board member for Students of Color for Public Health. Daphne's research in epidemiology, including publications on trans health, further demonstrate her commitment to health equity. The Public Health Global Health team commends her deep commitment to social justice, outstanding academic performance, and leadership in initiatives such as the annual ARCH Conference and Discern Collaborative. The team looks forward to celebrating Daphne's future as a physician grounded in public health values. Please join me in welcoming Daphne to the stage as this year's outstanding undergraduate student speaker.
Hi, Pookies. And hi to my family, Mom, Dad, and Aiden. Where are you over there? I can't see you, I'm blind. So, congratulations to the class of 2026. Woo! Unless you join me in failing our finals next week, so congrats to the class of 2027. Undergraduates, make some noise if you love your custom graduation stoles. Woo! Okay, yay. This was a 3-year effort put on by the PHDH resource coordinators, and I'm so glad that we're the first ever class to have them. Yay. I'm a PHDH graduate, and as part of last year's honors cohort, we read a book discussing institutional racism. And every week, a group of students would lead an activity based off of that week's chapters. And for my week, my group chose to make a mind mapping activity, map out the problems racism has caused, and then map out the enacted solutions. As we led the activity, though, it was becoming clear that there were a lot of problems, and not that many solutions. We were also very much aware that the map of problems was only going to grow. And since then, we've all had to carry an immense amount of grief. We mourn the over 50 individuals who have died because of ICE, including Alex Preddy and Renee Nicole Goode. We mourn the 156 civilians, including 110 children, who were killed by the US's missile strike in Iran. We mourn for our trans community, targeted by the over 1,000 proposed anti-trans bills, and we mourn the memory of Juniper Blessing. May she rest in peace. Faced with this institutional violence, I was scared for what the future of public health might be, because I felt like I had no agency to tackle any of the issues that we're facing. Yet one of the things that kept me going, though, was the strong community of the Students of Color for Public Health. See, every year we plan the Anti-Racism and Community Health Conference, ARCH, in which we invite Seattle's leaders to share how they're using anti-racist principles to improve community health. And one year, an attendee named Max just happened to pass by and chose to attend, despite the fact that he has no public health background. And turns out, Max was a journalist, sharing with me how the speakers were inspiring his agency to address institutional racism in his written work. And one of the speakers who inspired Max was a civil rights lawyer named Bina Ahmed. And she was inspired by college students who were organizing the pro-Palestine encampments. And so she encouraged us to use our agency to join the protests, but safely, by knowing our rights. And if we couldn't protest, she emphasized how crucial our values and public health training would be to every single field. See, the impact that Bina had on Max, the impact that all of ARCH's attendees had on its speakers, all of ARCH's speakers had on its attendees, could not have been possible without the 30 students making up the ARCH committee. Every year, they work tirelessly to expand the conference because at a time when social justice education is threatened, they are ensuring that there are still safe spaces for people like Max to seek it. And as I led ARCH, I witnessed the committee's profound joy and determination to use their agency to increase ARCH's impact, whether it's for their classmates, their peers, or in Max's case, a complete stranger. And their determination is infectious, inspiring me to remain resilient as a public health practitioner. So when our communities are being targeted, when public health feels fraught, we all feel like we have no agency. And I'm here to tell you that we do, and I know that we do, because my amazing classmates, peers, and friends are using their agency to create meaningful change. What defines our community of public health practitioners is not our jobs or our careers, but our values, what motivates us to keep showing up when the map of problems keeps growing. And as Bina hinted, the world needs our values now more than ever. Now the injustices we're fighting span past the traditional boundaries of what we might deem public health. So no matter where you go, your values will follow. It's just up to us to have trust in our collective agency and act on it, not just for ourselves, but for all the marginalized communities we're called to public health to fight for. Whether you're fighting for your immigrant parents, your trans friends, your neighbors displaced by war, or for people you may never meet, I have no doubt that the decisions you make and actions we all take will ultimately form a better today and an even greater tomorrow. Thank you, everyone, for this incredible community and how you've reminded me of my agency and my values. Yes, our map of problems is getting bigger, and I can't deny that. But we're the new public health practitioners in the field. And Pookies, I know we can handle it. Thank you.
Thank you, Daphne. Outstanding students at both the master's and doctoral levels are also selected by our departments and interdisciplinary programs, and it is from this pool that the Gilbert S. Omenn Award recipients are determined. These prestigious school-wide honors are awarded to one doctoral student and one master's student for outstanding scholarship and demonstrated commitment to the field of public health. Today, we will hear from both doctoral and master's recipients of the 2026 Omenn Award. First, I'm pleased to introduce Yifan Lin, recipient of the Master's Omenn Award from the Department of Biostatistics. Yifan Lin is a biostatistics MS thesis student whose innovative research has advanced high-dimensional genomics data. She developed an artificial intelligence framework to address the impact of unmeasured confounding, one of the toughest problems in observational public health research. By combining generative AI with traditional methods, she developed SensGen, a framework that improves interpretation of complex genomic data. She's presented her work at multiple conferences, has a published preprint, and is preparing for publication before beginning her PhD program. Beyond research, Yifan is an active leader, co-leading DEI initiatives and contributing to many community building efforts within the department. Please join me in welcoming Yifan to the podium.
Thank you, Dr. Kerr, for the introduction. Good morning, everyone. So when I was first asked to give this speech, I felt pretty intimidated. Since arriving here, I've been surrounded by so many brilliant, driven, and compassionate people. As I thought about what to share today, there was one lesson that stood out to me. I think we often enter new spaces believing that catching up to everyone else means success. But growth is not only about closing gaps. It is also about recognizing your unique perspectives and contributing to those strengths. During my first stats inference class, I became very aware of how much people around me knew. Some of my classmates had deep and strong training in statistics, while others brought years of experience in public health. Meanwhile, I came from a biomedical engineering background, actually. At first, that difference made me really wonder whether I truly belong here. Over time, my classmates and mentors helped me realize that things are actually very different. Everyone in this program brought something valuable, and public health was never meant to be built by one kind of person. For me, studying biostats gave me a stronger theoretical tools and new methods for working with biomedical data. And just as importantly, it helped me realize that my background was not a limitation. It was something that I could offer. One of the greatest gifts UW School of Public Health gave me was the chance to learn from people with very different perspectives. I learned from theorists whose ways of thinking always challenged me to grow, and I also learned from clinicians and many others that health is always about the people. Public health exists because no single perspective is enough. The challenge that we face today, pandemics, chronic disease, mental health, climate change, and health inequalities are all too complex for one discipline to solve alone. That is why it is so important that we carry forward the perspectives that brought us here in the first place. To the class of 2026, there will be time when you feel lost, behind, uncertain, or different. I know that I have, and I hope you remember that your backgrounds, your experiences, and the questions you naturally ask are gonna become one of your greatest strengths in the future. Congratulations of class of 2026, and thank you so much.
Thank you, Yifan, and congratulations. Next, I'm pleased to announce our doctoral Omenn awardee. Betty Cohn from the Institute of Public Health Genetics. Betty Cohn is a PhD candidate in public health genetics at the University of Washington and a trained bioethicist holding a BA from Binghamton University and a Master of Bioethics from Johns Hopkins Berman Institute of Bioethics. Her research examines the ethical, legal, and social implications of emerging biotechnologies, including direct-to-consumer genetic testing and polygenic risk scores. Using qualitative methods, her dissertation explores how individuals who discover a misattributed parentage experience through genetic testing navigate these findings, with a focus on online communities as sources of social support. Betty aspires to become an independent principal investigator at an academic institution. Please join me in welcoming Betty to the podium.
Thank you so much for this honor. When I learned that this award was named after Dr. Gil Omenn, whose vision made the Institute for Public Health Genetics possible, it felt like a full circle moment. He championed the creation of this program and never stopped believing in what this institute could do. And what it could do is produce people like us. So Dr. Omenn, if you're watching, it worked. Standing here as a public health genetics graduate feels especially meaningful because I almost wasn't a public health genetics student at all. My original plan was to become a genetic counselor. I applied to over 10 programs. I didn't get into any of them. And at the time, it felt like a wall. But really, it was a detour, and a better one than I could have planned. During a summer research internship abroad, I attended a talk by a professor at Johns Hopkins and asked a question. That conversation led to a master's degree in bioethics at Hopkins. And my advisor there knew my advisor here, and that connection brought me to UW, to public health genetics, and to this stage. None of it was planned, and all of it mattered. I want to talk to you today about something called side quests. The main quest is the obvious planned path, but a side quest is optional. It takes you off-road. Without them, you can technically achieve your goals, but you can miss so much. Graduate school, I've learned, is full of side quests. During COVID, when meetings moved online, I made a small but deliberate choice. I always turned my camera on, and I always asked one question, even if it felt awkward. After my first year at UW, I cold emailed a researcher I'd seen at those seminars. She remembered me, the person with her camera on, the one who asked questions. And that email turned into an internship, the first successful side quest at UW. I once TA'd a nutrition research methods class. Nutrition is not my area of expertise, but I was trained in research methods, and with the guidance of amazing faculty here at UW, I helped teach the class. At the end of the class, one student approached to work with me on my research. She became a second coder on one of my dissertation aims. That collaboration will become a publication for both of us. Another successful side quest for both me and another student. In my second year at UW, I took an elective class, and for the final paper, I wrote a literature review on a topic I was curious about. My professor encouraged me to try to publish it. So I cold emailed researchers whose work I had cited. 2 of them said yes. That paper is now published in Genetics and Medicine, another successful side quest. And I want to be honest with you, it's not easy to be in public health right now. The last several years have tested this field in ways none of us expected. There were moments when I wasn't sure what I believed about the institutions I'd given my energy to. But each time I hit a moment of doubt, I looked for a side quest, something that renewed my faith in what public health can be and what academics can do when they are passionate about the work. Cumulatively, those side quests led to 8 publications, 3 TA positions, a master's in bioethics, a PhD in public health genetics, and next, a postdoctoral fellowship at the University of Pennsylvania. None of that was planned, and all of it came from saying yes to the unexpected. So here is what I want to leave you with. Your path does not have to be linear. In fact, the best ones rarely are. You will face things that look like roadblocks. Some of them will genuinely be hard. But I hope you'll look at each one and ask, is this a wall or is this a stepping stone? Choose to step up. Say yes to the side quests, turn your camera on, ask the question, send the email, TA the class outside of your expertise. You don't always know where the path may lead, but you will always be glad you walked it. Thank you, and congratulations to the class of 2026.
Thank you, Daphne, Yifan, and Betty, for your speeches. Next, we are honored to welcome this year's graduation speaker, Dr. Myra Parker. Myra Parker, JD, MPH, PhD, is an associate professor of psychiatry and behavioral sciences and director of 7 Directions, a center for indigenous public health based within the Center for the Study of Health and Risk Behaviors at the University of Washington. She received her doctorate in health services at the UW School of Public Health in 2010 and has been a member of the faculty since 2011. Dr. Parker has worked with tribal and urban Indian communities across the United States on many pressing issues. These include cultural adaptation of alcohol and drug interventions, with the focus on reducing alcohol use among tribal college students, development and testing of parenting interventions to support early childhood development, comorbidity of substance use with depression, suicide, trauma, and PTSD, research capacity development, including ethical aspects of research, and the dissemination and translation of evidence-based prevention and intervention approaches. These are implemented at the individual, institutional, and community level and include policy development. Please help me in welcoming Myra Parker.
Thank you, Dean Godwin. Congratulations, graduates. Congratulations, family members who have supported them all these many months and years on their journey. It's my honor to be here with you all. Mabi Zagids, Marashi Mirkhaba Wiyahets. I said, it's a good day today. My name is Cedar Woman in the Hidatsa language, which is one of the tribes that I'm a member of. It's my honor to be here to share in all of your accomplishments. I'm really thrilled to be selected as the Alumni of Impact for this year. Culturally, for the Mandan and Hidatsa tribes, it's customary to give something away when you receive an honor. And so today, I'd like to give you a story from my tribe, the Mandan tribe. One of the most exciting and fulfilling parts of my work is to elevate Indigenous knowledge and to integrate it into public health practice. Indigenous scholars have identified several types of knowledge, including empirical knowledge, which I know you all are experts in. The other types include revealed knowledge, understandings that coalesce from dreams, ceremony, visions, and feelings, and traditional knowledge, which includes critical information passed down across generations, such as oral histories, creation stories, songs, and dances. For 95 years, our American Indian and Alaska Native revealed and traditional knowledge was literally outlawed in the United States. In 1883, the Code of Indian Offenses made dancing, ceremonies, and feasting crimes. Imagine your community isn't able to practice the fundamental aspects of your culture for fear of retaliation, imprisonment, or worse. These practices were illegal until 1978. Through the passage of the American Indian Religious Freedom Act, Congress decriminalized these essential cultural practices. At that time, I was 5 years old. The story I'll give you today underscores the importance of traditional knowledge and perhaps offers hope for all of us that these teachings can provide a path through the difficult times when hate, bad actors, and sometimes horrific acts threaten to overwhelm us. Before the creation of the United States, the Mandan had a massive trade center on the banks of the Missouri River in what is now called North Dakota. We traded our corn, beans, squash, and sunflower seeds and other goods with neighboring tribes, and when the French and English fur traders came to the region, we traded with them too. There were over 25,000 Mandan village members in the 1700s, and the produce from our gardens benefited from the rich river bottom land that was naturally replenished each year when the spring flooding came. We also hunted buffalo and revered them as relatives. We have many stories about how our people have sometimes become buffalo and they have become us. We are so intertwined. As the tribes in this region are defined by the salmon, the Mandan and the Hidatsa were defined by the buffalo. When they were hunted to near extinction, we nearly lost our beloved relatives, and we're still fighting to bring them back to full strength. In 1837, smallpox came to our community through a steamboat that traveled up the Missouri River. We had no natural immunity, and over 90% of our people died. It turns out that that was unnecessary, as the US government provided smallpox inoculations to several of the other tribes in the region, but not to us. At the same time, some of us survived. My grandmother, Myra Baker, related how one of my great-great-grandmothers recovered from smallpox by immersing herself in the cooling waters of the Missouri River. Along with these individuals who practice these traditional knowledge approaches, survived traditional medicines, our languages, stories, and tribal way of life for many more years. The Mandan story that I'll tell you today was told by an elder, Mrs. Ottersage, in the Mandan language. It was translated by a Mandan and Hidatsa tribal member, Marie Chase Fredericks. This story demonstrates the power of compassion, and the sheer existence of this indigenous knowledge defies all the odds. Now I'm going to tell you the story of when Coyote, or Inomuxi in the Mandan language, raced the buffalo. Inomuxi was traveling, as always. When he reached the clay hills, he saw a buffalo bull, and when he saw it, he started to get excited. And he thought, I spy a fat buffalo bull, I'm going right over there. As Inomuxi came up to him, the bull was terrified. My uncle, exclaimed the bull, I saw you, and as soon as I recognized you, I thought, that guy's always up to no good. That's why I wanted to take off running. Inomuxi replied, that's not nice, don't be that way. Here I'm just kind of traveling along and I just happened to run into you on my way. You know, they always say there's some doubt as to which one of us is faster, so I thought today we could have a race. The bull immediately agreed. Yes, it will be so. Good, good, so I'll go put up a marker. I'll go way over there, and when I get back, we'll race. Yes, agreed the bull. Enomuxi went along the edge of the riverbank to put up the marker, looking carefully to see where the bank was really steep. There along the edge, he put up the marker and he went back to the bull. He said, "Well, my nephew, now we'll race. We'll finally find out which one of us is faster. I put up our marker way over there, if you can see it. When we get there, we'll close our eyes really tight and run as fast as we can." "Yes," said the bull, "that'll be the way. If you go on the right side, I'll go on the left side," said Enomuxi. "Yes," said the bull. Enomuxi made a mark in the dirt for a start line, and they lined up. He said, "Go," and they took off running. When they reached the marker, they closed their eyes tight and started running really fast. The bull had both his eyes closed as he sped up, but Enomuxi only had one of his eyes closed, and he steered clear of the edge of the cliff. Meanwhile, the bull, with both his eyes closed, ran right over the bank of the river, and his feet were flailing in the air. "That's the way," exclaimed Enomuxi. "That's going to make a really good meal." He was so happy and proud of how he tricked his nephew. He climbed all the way down the riverbank where the bull lay dead, and he was in such a good mood because he thought he was going to eat really good that day. So he was taking his time, really savoring the thought, and he was looking for a nice big rock that he could whittle into a knife to butcher the bull. And he started singing a victory song for himself. Finally, he found a rock and he said, "This knife is really sharp. I'll use it to butcher that bull." As he said this, the knife magically became really sharp. And when that knife got worn down, he picked up another rock and he said, "This rock is really sharp." And lo and behold, that rock turned into a really sharp knife. As he said these things, he made it so. So he started butchering that bull, and as he did so, he started singing again. And he was having such a good old time thinking about the feast that he would have. Meanwhile, Porcupine came along, and he heard all of the singing, and he wondered what was going on. "You were kind of singing something there. What was it, Elder?" he asked. Now, Enomuxi was really surprised by Porcupine showing up, and he was feeling a little standoffish. When Porcupine said that, he replied, "I never sang nothing at all. I sang nothing and I said nothing." "No, I heard it just now as I came by," said Porcupine. "No, sir," said Enomuxi. Finally, Enomuxi said, "Oh, all right, it's true. I was just singing because I killed something, and here I killed a bull, and that's what I was singing about." "That's what I thought," said Porcupine. "Come on, you can help me skin it then." Together they went over to the bull, and Enomuxi gave Porcupine a knife. "Here, you take one side of the bull and skin it, and I'll take the other side," said Enomuxi. He was skinning it, and it's really hard work, but he was fast, that old scoundrel. "Hey, whoever finishes skinning his side the fastest will have the whole thing," he cried. Porcupine was trying really hard, but he was too slow. Meanwhile, Enomuxi got through skinning it, and right away he said, "Go on, get out of here. Like I said, I'm already done. Go on, it's mine." Oh, Porcupine felt bad. He felt so bad, he started crying and crying so hard that as he went, all the coyotes and mountain lions, bears, wolves, and everyone heard him and came to see. They all asked, "How come you're crying?" He replied, "That old scoundrel, he killed something and he made me skin half of it. And I was really skinning it when he said, 'Whoever gets through skinning it first will have it.' After he said that, I was skinning the best I could. But he finished first and he told me, 'Go away.' Now I came and I'm feeling really bad, and so I'm crying. That one is no good, and he'll probably eat the whole thing." Every animal he saw, he told them what happened. And all the animals, having heard how he got tricked, got angry for him on his behalf. They all got together and said, "That no good scoundrel, he won't get to eat any." They were so mad, they said, "He's sure no good, that one. That elder is really bad. We know all about him and the crooked things he does all the time. Since he's so no good, he won't get to eat any." All this time, Enomuxi was cutting up his meat, and he finally got done and he put it in a big pile. He was so tired of cutting it up and lugging it around. When he saw a nice big rock, he thought, "I'll just sit down here and rest for a bit. When I get my breath back, I'll finish up." So he sat down and he was relaxing on the nice big warm rock and really resting all his tired muscles when all of a sudden a coyote's head poked out of a hole nearby. "Hey, what are you doing?" yelled Inomuxi. As soon as he yelled, the coyote pulled his head back and left. A little while later, it happened again. This time a wolf poked his head out of a bush and was looking at him. Inomuxi started to get mad. "What are you doing? Here, go on," he yelled. Still, he stayed sitting there on that big rock, and a little while later, a bear peeked out, and all around him he saw the heads of all the angry animals were stuck out staring at him, and he got really mad and yelled at them to get away, and they scattered and pulled back. Now one of the wolves appeared to be coming towards him. "Hey, you over there, stay there. What are you doing coming over there?" he yelled, getting after him. "That's my food there," he bellowed, and he tried to get up, but when he did, he found out he was stuck fast to the rock. The rock was holding him down, and he couldn't get up, even though he was struggling to stand up. So then the animals saw this, and they all surged forward, and they waited to see if he would hit them with his stick. But Inomuxi was stuck to the rock really good, and he couldn't even grab his stick. At last, when they knew for sure that he couldn't get after them, they surrounded his pile of meat and they cleaned it all up. There was nothing left. As soon as they ate it all up, they scattered and took off. Oh, Inomuxi cried and yelled really loud, and he pulled himself off of the rock with his fur and skin left behind. "Oh, that was a good thing I had there. Here, I didn't even have a chance to eat any of that delicious fat or tasty kidneys. I didn't have anything to eat. Why did I have to be so bad? That was a really bad thing I did," he cried. He was crying really hard by now. "I did a really bad thing, and that's why my grandson Porcupine did this. I made him go away, and I really got after him. That's why this happened." He realized what he did was wrong, but he couldn't do anything about it. His meat was already all gone. It was eaten up, and the animals took off, it said, leaving him alone and hungry. In our stories, as with many other tribes, Inomuxi is always hungry, always traveling, looking for more. And in our stories, he often seizes defeat from the jaws of victory. He's a powerful being, also known as First Creator. Yet, as is reflected in the story, there's something about how he sees the world, relates to others, and positions himself that isn't quite right. He has many characteristics of actual coyotes, and at the same time, he has his own magic. As we saw, it didn't take him hours to nap the knife. And a personality that pulls other beings irresistibly into his orbit, and thus his schemes, usually aimed at swindling them or taking something from them. As Dr. Joanne Archibald, an Indigenous scholar from the Stolo First Nation, relates, the cultural values of respect, responsibility, reciprocity, and reverence are embedded in Indigenous stories. We can begin to see that reflected in this story of Inomuxi racing the buffalo, in which the buffalo, despite his misgivings, calls Inomuxi uncle. In many Native cultures, we're defined by who we're related to, and our responsibilities to our relatives are informed by these ties. Yet in this story, as we see, Inomuxi never truly honors them. In fact, his actions represent an abhorrent violation of the behaviors these relationships would normally engender. Through the course of this story, we see Inomuxi's overconfidence and self-satisfaction, along with his self-aggrandizement, prove to contribute to his undoing. His bragging and self-celebration cause him to be discovered by Porcupine. His lowly trick to race Porcupine sets up a cavalcade of community response after Porcupine cries in distress. His pleasure in taking a rest on the nice warm rock when the bull meat was still not completely processed results in the rock stepping in to help mete out justice. He has things too easy, and at the end, he's alone, dejected, somewhat regretful, but certainly not about the most critical violation of all, which was the bull's murder, and he's still hungry. Importantly, it takes the entire community of helpers to do something about this bad elder and swindler. It's this lesson that is important for all of us to take with us as we go about addressing public health issues in each of our respective communities. As we've heard earlier, no one can solve these big problems alone. Together, as we saw in the story, we have more power than even the most charismatic, ravenous tricksters. But we have to ask for help, and we also have to listen. We have to keep asking for help until people listen to us and feel compassion for us and our problems to the point where we can all join together to tackle them as one. That in and of itself is kind of a revealed knowledge, a trait we humans share across cultures and populations. We care. Sure, there are bad actors, maybe even monsters, or their human counterparts. But on the whole, there are many other helpers and healers, and many of them are seated right here. Graduates, look to your left and look to your right. It's okay to make eye contact with folks. Turn on the Zoom picture. Look all around you. You know that these are also your people. They are the epidemiologists who will save us all in the next global pandemic at some now unforeseen time in the future. They are the biostatisticians who will crunch large data sets deep into the night to track down the public health trends that we need to understand. They're the COPHP graduates who will take all of this knowledge and strategies and put it into action in our communities to save lives, make our existence that much easier, and change our world. They're the PhD graduates who will continue to broaden and deepen the knowledge that will take us into the next century and the next. And not only that, they'll teach and mentor, sowing the seeds of knowledge and innovation that will grow future generations of public health experts. They are the environmental planners and knowledge keepers who will save us from ourselves as they improve our understanding of the world, both built and natural. They are the systems thinkers and analysts who will help streamline our health systems using a holistic, strengths-based, and tailored approach. They are the global health experts who will take all of these strategies on the road to communities who will benefit from the love and compassion that they bring to their work. We are not Inomuxi. We may see aspects of him in us, and it can be frightening. On the whole, we retain our humanity, our love for one another, our planet, our communities, and all the beautiful living things that surround us. We're truly grateful for all the knowledge and opportunities we've had in this wonderful institution and for over the course of our lives. And we decided to give back something we received from this bounty and pay it forward to help others, because others helped us one time or 5 or maybe too many times to count. Ask for help, listen to those who need your help, tell your stories, and care. This story survived a smallpox epidemic that wiped out 90% of the people that carried it forward. This is the power of knowledge and human connection that we must continue to draw on and strengthen. May you take this piece of Indigenous knowledge into each of your future roles, connect with one another, and outwit the coyotes you come across. I wish you all many blessings. Mazigarats. Thank you.
Myra, we are so honored by your presence and your speech today, and I'm happy to present you with the Stole of Gratitude, an emblem of our appreciation representing this special day and displaying our university's seal. As we proceed with the doctoral hooding ceremony, I would like to now call Juanita Ricks, Assistant Dean for Students, who will give us a little introduction.
This year, 91 students will earn a Doctor of Philosophy or a Doctor of Global Health degree in the School of Public Health. And we honor those candidates who can be here with us during our hooding ceremony. The ceremony symbolizes the passing the guard from one generation of scholars to the next. During the ceremony, the faculty chair or designee will place the doctoral hood over the head of the graduate, signifying his or her success in completing their degree requirements. School of Public Health, doctoral candidates, please line up.
Should I go ahead and start? Okay. I would like to now call on Dr. Ali Shoji, Interim Chair of the Department of Biostatistics, to recognize our graduates from that department receiving a Doctor of Philosophy degree.
Yifan Ashby. Now, methodological advances in using negative controlled endpoints to improve vaccine effectiveness estimation. Thank you. Ellen Graham. Semi-parametric inference with incomplete data, data fusion, instrumental variables, and proximal causal models. This concludes the doctoral graduates for the school, for the Department of Biostatistics.
I'd like to now call on Dr. June Spector, Chair of the Department of Environmental and Occupational Health Sciences, to recognize our graduates from that department receiving a Doctor of Philosophy degree.
Allison Punch. Psychosocial hazards at work, organizational stressors, interpersonal exposures, and mental health across U.S. working populations. Ashley Moore. Understanding barriers and solutions to partnership for public health emergency preparedness. Viviana Alban. Animal exposure and infant health, exploring gut microbiome and antimicrobial resistance dynamics in Ecuadorian infants. Go. Christopher Boyer, examining climate and health adaptation implementation in Pacific Island countries and territories. Callan Kravenko, characterizing respiratory exposures and health symptoms in cannabis production workers. Lillian Liu, Firewise, public health impact and response on wildfire exposure and health support and evaluation. Kyle Joo-hyun Kim, investigating the implications of oral microplastic exposure within the context of the gut-brain axis. This concludes the doctoral graduates from the Department of Environmental and Occupational Health Sciences.
I now have the pleasure of calling on Dr. Karen Edwards, Chair of the Department of Epidemiology, to recognize our graduates from that department receiving a Doctor of Philosophy degree.
Ayumi Saito, towards whole person health, investigating the gut-brain axis and low back pain in symptomatic lumbar spinal stenosis using traditional Indian medicine-informed theoretical model. Anna Harrington, living apart, breathing apart, associations between racial residential segregation, air pollution exposure, and chronic disease. Okay. Susana Lozana Esparza, polycystic ovary syndrome in Mexico, from adolescence to adulthood. Molly Fisher, herpes simplex virus in transplant recipients, evaluating serostatus, shedding, and breakthrough infection. Omalara Akingbang, STI burden, PrEP use, and client experiences in integrated pharmacy-based sexual health services for adolescent girls and young women in Kisumu, Kenya. Chidozie Iwu, clinical epidemiology, genomic diversity, and antibody kinetics of respiratory viruses in community-based settings. Holrain Freevold, associations between influenza vaccination during pregnancy and outcomes related to maternal influenza disease, infant anthropometry, nutritional status, and cost effectiveness in Nepal. Rifut Ara Shahon, malnutrition among children under 5 with neurodevelopment disabilities, identifying and managing risk using multi-method study. Anjali Vasavada, optimizing patient-centered interventions using digital health for repeat lung cancer screening in Washington State. Magali Sanchez, Ortega, incorporating equity in influenza vaccination strategies and assessment of neighborhood disadvantage and influenza outcomes. Ruby Lucas, characterizing sexual and reproductive health needs, experiences, and disparities in care access among transgender, non-binary, and gender-expansive communities in the United States. Miriam Flores Moreno, Beyond the Crops, the health impacts of precarious farm work. Shengru Zhang, Understanding and Addressing Barriers to Cervical Cancer Screening, Patient Perspectives and the Impact of HPV Self-Sampling Interventions. This concludes the graduates from the Department of Epidemiology.
I now call on Michelle Averill to recognize our graduates from Food Systems, Nutrition, and Health Program, receiving a Doctor of Philosophy degree.
Norma Garfias Avilla. How much do red and processed meats affect our gut? Investigation of the gut microbiome following randomized controlled diets with and without red and processed meat, the Eat Well study. That concludes the graduates from the Food Systems, Nutrition, and Health program.
Okay, there we go. Okay, it is my pleasure to now call on Dr. Heidi Van Rooyen, Chair of the Department of Global Health, to recognize our graduates from that department receiving a Doctor of Philosophy or a Doctor of Global Health degree.
Patience Komba, a life cycle approach to digital health, implementation, evidence, decision-making, and leadership in practice. George Horace Wanje, a multi-methods implementation research evaluation of a program scale cluster randomized trial to improve integration of HIV prevention and treatment services in family planning clinics in Kenya. Parigya Sharma, grounding global frameworks in local practice, advancing leadership, strategy, and health equity. Evelyn Nyanga, toward equitable health systems, a portfolio on rural-urban health dynamics and community-based workforce development in Washington State. Diadane Hazikazamana, I apologize. Utilizing implementation science approaches to evaluate and guide scale-up of child health programs involving trusted local influencers in Ethiopia. That was Diadane Hakizamana. This is Mohammed Ghazi Shah Alum. Strengthening pandemic preparedness in low and middle income countries through coordinated surveillance and data sharing for diseases and countermeasures. Priyanka Shritha, using an equity lens to assess drivers of implementation outcomes of a digital health intervention in Western Kenya. Coco Alarcon, implementation outcomes and impacts of Ciudad Medio Ambiente y Salud, an environmental initiative promoting One Health in Iquitos, Peru. Stelio Virgilio Tembe, strengthening maternal and newborn health through quality improvement in Nampula, Mozambique. That concludes the graduates for the Department of Global Health.
I now call on Dr. Megha Ramaswamy, Chair of the Department of Health Systems and Population Health, to recognize our graduates from that department receiving a Doctor of Philosophy degree.
Zoe Pleasure, improving contraceptive care for veterans with autoimmune conditions. Stephanie Flores Acevedo, working alone, the role of psychosocial safety, climate, and working conditions on occupational stress and injuries among lone workers in the U.S. Angela Chen, informing health policies and interventions to increase human papillomavirus vaccination among adolescents for cancer prevention in the United States. Juan Gaudino, challenging the narrative of deficit discourse, identify strengths supporting mental health among Latina immigrant women. Bulat Idrosov. Okay. Spending analysis for HIV and opioid use from 2010 to 2019, variation by area and demographics. This concludes the graduates from the Department of Health Systems and Population Health.
All right. I now call on Allison Foner to recognize our graduates from the Public Health Genetics Program receiving a Doctor of Philosophy degree.
Betty Cohn, from preparedness to social support, how individuals navigate misattributed parentage experiences. Nikita Damaraju, long read sequencing in genetic medicine, evaluating haplotype identification, identity by descent analysis, and diagnostic yield.
Now it's time to acknowledge and celebrate the remaining class of 2026, starting with our master's students from each department and then undergraduates. Please welcome Associate Dean for Faculty, Stephanie Farquhar, who will preside over the recognition of graduates.
All right, should we get graduated? I want to add my congratulations to all of our graduating students, my huge appreciation to the family and friends who are here today to help us celebrate. Thank you again. And as a small token of our gratitude, each graduating student will receive a soul catcher pin. That's what's in the little box. And the soul catcher is a native symbol for physical and spiritual well-being that represents our commitment to educating innovative and diverse public health leaders and scientists, promoting the well-being of communities, and honoring and respecting the knowledge and traditions of the original inhabitants of this land. This version of the soul catcher, was designed for and gifted to our school by renowned Native artist and former UW faculty member Marvin Oliver, who drew his inspiration from the Coast Salish traditions. So now it's time to acknowledge and celebrate this year's graduating class. Students will be recognized by departments, beginning with students receiving a master's degree, followed by undergraduate degrees. To call our graduating students' names as they receive their degrees, we welcome Amanda Phipps, Anjali Ganti, Jenya Shimkin, Kate West, Liz Kirk, and Rabi Yunusa. All right. Everyone in their places. Excellent. I call on Dr. Ali Soje, Interim Chair of the Department for Biostatistics, to recognize our graduates from that department. We will recognize our biostatistics graduates receiving a Master of Science degree. We're going to share a little bit about each department before we hand out the diplomas. Biostatistics is how we turn data into knowledge that we use to improve health. Our graduates from biostatistics learn to use statistical methods, advanced computing, and machine learning to better answer questions like whether a new drug works, what causes cancer, and how long a person with a certain illness is likely to survive. Our department has a long record of excellence. It is currently the #1 ranked public biostatistics program in the United States. And now we are pleased to recognize our biostatistics graduates receiving Master of Science degrees.
Yifan Lin.
I now call on Dr. June Spector, Chair of the Department of Environmental and Occupational Health Sciences. Whoops, Stephanie, sorry. You want to finish?
Sciences.
This is supposed to be you, not me.
Sorry.
Sorry about that.
Just one moment, we're going to get reorganized here. The top-ranked Department of Environmental and Occupational Health Sciences works to ensure that everyone has a safe place to work and a healthy, safe neighborhood to call home. Our graduates are trained in the lab, field, and classroom to support communities with clean air, clean water, safe food, and safe workplaces. They will make Washington, America, and our world healthier, safer, and more prosperous. Now we're thrilled to recognize our environmental and occupational health sciences graduates receiving a Master of Public Health, Master of Science, and bachelor's degrees.
Anna Erickson. Mariah Rubin. Ashlyn Gonzalez Soriano. Maria Victoria Peña. Adriana Rieño. Matthew Hilleman. Scott Katz. Juliana Moreno. Xinju Zhong. Daniel Rodriguez Pantaleon. Sarah Fellbaum. Sophie Elliott. Vedika Hejmadi. Janielle Damal. Xinyuan Hao. Emily Doe. Isabella Deloa. Quinn Bergen. Cadence Freitas. Shamini Reynolds. Lucille Daniels. Megan Chua. Jisoo Yang. Mora Jiao. Cameron Pon. Catherine Hayes. Annika Shashidar. Sarah Ramelat. Annika Jarman. Angelina. Tejasvini Vijay. Charlotte Krakow. Jacqueline Simpson. Jordan Oldenburg. Katrina Gunvaldson. Brianna Blanchard. Michaela Pasqua. Ji-Hoo Jun. Cassandra Sanchez Franco.
These are the graduates from the Department of Environmental and Occupational Health Sciences. I now call on Dr. Karen Edwards, Chair of the Department of Epidemiology, to recognize our graduates from that department.
We'll take your card. Thank you.
Ever wonder who gets sick and why? Then you may be an epidemiologist. Epidemiologists discover the causes and the conditions of diseases and disorders, their effects on our society and our economy, and how best to prevent them. Building on a legacy of world-class research and real-world impact from researching HIV to cancer to COVID-19, today's graduates carry that excellence forward, addressing the most urgent health challenges locally and globally. Now we are honored to recognize our epidemiology graduates receiving a Master of Public Health and Master of Science degrees.
Hafsa Zia. Oh, sorry. Did you introduce Karen? Okay. Ralph Tyre. Nathaniel Odell. Victor Palanco Vargas. Biplav Shretha. Het Ong. Aneth Mbo. Aiden Afwork. Alexa Giovanati. Paulina Vega. Jerica Warner. Lyle Glate. An Pan. Rebecca Kamer. Carolyn Graham. Luciana Lenth. Gabby Mascarenas. Megan Lindell. Becca Duncan. Emily Bass Kendall. Emily Godina. Kayla Kenyon. Charlotte Bryn. Kayla Egberg. Audrey Hersman. Daria Gaussman. Michael Wallach. Jamie Lan. Thea Ben Ali. Renee Hawks. Juhi Thomas. Raymond Lamb. Sahiti Julie Puli. Ritaj Elganai. India Jackson. Jennifer Rosauer. Tristan Cassidy. Ryan Brunell.
And these are the graduates from the Department of Epidemiology. I am now calling on Dr. Haiti Van Rooyen, Chair of the Department of Global Health, to recognize the graduates for this department. The Department of Global Health addresses issues that cross borders: infectious diseases, maternal and child health, chronic disease, health impacts of conflict, and climate change. For decades, UW Global Health graduates have led equitable local health progress around the world. By addressing health problems on the global stage, our graduates help communities at home and abroad be healthier and safer. We are now happy to recognize our global health graduates receiving Master of Public Health and Master of Science degrees.
Miriam Sibgatula. Pallavi Shrestha. Sophia Donovan. Christelle Urgeni. Margaret Nickel. Brooke Erickson. Shelby Thurman. Miriam Hamad. Sorry. Samantha Tran. Christina Ruha. Oh, I am sorry. Ishwan Wang. Salome Marimbet. Tumar Lar. Zawi Yanbo. Husam Alatar. Mackenzie Kanege. Temi Ramadan. Edna Oji. Sirilas Osango. Ricardo Moreno Garcia. Paola Armenta. Ale Barrientos. Charlotte Thompson. Baruch Araya. Amanda Debouder. Faraja Yusta Mgaya.
These are the graduates of the Department of Global Health. I now call on Dr. Megha Ramaswamy, Chair of the Department of Health Systems and Population Health, to recognize our graduates from that department. The Department of Health Systems and Population Health helps every American live their best life. Graduates work with the systems that serve, impact, and determine the health of all Americans. Hospitals and governments, caregiving and community health, industry and business. Our graduates will lead the way in identifying what causes populations of people to be sick, then will design policy, care, and services to address health problems at their core, where they start. Now we are excited to recognize our health systems and population health graduates receiving Master of Public Health and Master of Science.
Anusha Suladmat. Sukhneet Kaur Tour. Sabrina Schaefer. Sarah Mahan. Rico Romo. We're going too fast. Ethan Hume. Erica Granados. Christopher Cummings. Emily Diaz Barragan. Jane Zhao. Zoe Finch. Ellie Paris. Sarah Seeger. Julia Owens. Pooja Pooja Manjunath. Sorry, Pooja. Paige Maida. Andy Pham. Danny Jung Yu Ang. Roberto Ramirez. Camille Curran King. Thank you. Ariana Rastani. Daniela Villalobos. Sarah Baumgardner. Bethlehem Demeke Tesema. Diana Newell. Angela Kim. Fallon Zollers. Madeline Ava Hawes. Great. Tassie Jones. Amy Paulson. Sophia Tulino. Kylie Bevercombe. Dakota Kesterson. Mikaela Sakurai. Delina Muse Eyasu Siyuam. Amarvir Mali. Rachel Madwed. Easy peasy. I love it. Ashley Kim. Danya Siddiqui. Hafsa Mustafa Harir. Pamela Tracy. Zofia Palowski. Kara Graham. Jeannie Bay. Valerie Moran. Rebecca Tilahun Ayele. Sally Shinla Jo. Alces Zarina Lavitoria Nonot. Hannah Aiken. Denise Ann Felipe. Rosita Boyce. Lydia King. Kayliana Guerrero.
These are the graduates from the Department of Health Systems and Population Health. I call on Kurt O'Brien, Interim Director of the Health Management and Informatics Program, to join Dr. Ramaswamy to recognize our graduates receiving a Master of Health Administration, Master of Health Informatics and Health Information Management, and our undergraduate program in Health Informatics and Health Information Management.
Okay, and then you're gonna go that way. Yedidia Kafala. Brian Kadina Barbosa. Alan Henderson. Stephanie Stahl. Laura Steele Alford. Sorry. Juan Contreras Mora. Eunice Hong. Isa Riaporn Kanta. Jordan Finney. Jason Rubin. Angelina Mercedes Salazar. Kelly Hurley. Danny Christine Cuipo Dinlocker Santiago. Hannah Bekele. Catherine Burgess. Julia Heng. Tommy Nguyen. Deborah Moyosore Daniels. Carly Rismon. Kristen Coot. Jenny Fan. Aaron Morris. Marie Gemundo Kingombe. Tiffany Tang. Claire Cho. Ara Cho. Rupinder Kar Gotra. Jaden Marie De Jesus. Henry Vo. Charlotte Dismore. Florence Wainaya. Sri Kirtana Sati Rajo. Justdeep Atwal. Hira Bashar. Irene Lee. Sydney Soot. Maria Lawandi. Sena Abera. Nguyen Tran. Ji Hyun Choi. Jamie Kim. Catherine Fan. Cindy No. Amira Mohammed. Naja Goodrich. Kiet Duong. Wen Fan. Sarong Lee. Kent Garma. Joshua Daniel Flores Da. Yasin Rahman. Anthony Som. Maya Chen. Maya, sorry, Maya, like the month. Maya Chen. Sorry. Morgan Carr. Caitlin Bowie. Sophia Gabrielle Hayag. Marian Hilo. Kayla Gilmore. Wenjun Zheng. Anchi Huang. Balkais Ismail. Xinhua Zhang. Sunny Yang. Anna Kong. Masai Gazagne Niguse. Mariam Jallo. Hannah Pulido. Natalia Ayala Simon. Navdeep Maan. Jocelyn Vanessa Lopez Hernandez. Stephanie Joy Miran. Lala Tunja.
These are the graduates from the Health Informatics and Health Information Management and Health Administration programs. I call on Dr. Allison Foner, Director of the Institute for Public Health Genetics, to recognize our graduates receiving master's degrees from the Institute for Public Health Genetics.
Good. Okay. Kelsey Viglietta. Ibrahim Duffus. Alex Dunquo.
These are the graduates from the Public Health Genetics program. I call on Dr. Michelle Averill, Director of our Food Systems, Nutrition, and Health program, to recognize our graduates from that program receiving Master of Public Health, Master of Science degrees, and Bachelor degrees.
Thank you. Are we ready? Okay. Gabrielle Cyrus. Anna Schwerdfeger. Katie Allen. Grishma Gurudatta Malia. Adrian Atkins. Elisa Chivillano. Emma Wynn. Michaela Slovkin. Vanessa Tran. Nelma Skilling.
All right. Yuan Zi Zhao. Kei Ni. Xinzhu Liu. Si Tong Sheng. Mary Mills. Hilal Ozkan. Neko Pasternak. Avalon Whitten. Vanessa Perez. Lizzie Kaiser. Lana Huang. Elika Moeller. Natalia Bobroff. Sophia Pilot. Vanshika Govind. Emma Lundberg. Yan Fan. Abigail Helwig. Sina Sue May. Thomas Choice. Aaliyah Thompson. Annika Sorensen. Jordan Kuzmich. Andy Aquino. Daniel Quaycrop. Ezra Armani Acevedo. Carmela Stewart. Priyal Gondar. Ola El Hassan. Rebecca Himida. Hannah Sakia. Esther Mang. Christopher Moon. Gavin Guerrero. Jack George Daliwal. Peyton Makapule. Fatih Ahmed. Madeline Chen. Farzan Haroon. Isabella Fritz. Justine Pantig Ball. Malia Kubudera. Brian Wynn. Jialan Ma. Grace Shin. Carrie Min. Carla Yu. Lu Ling Wang. Yi Xiong. Yixin Zhang. Yu Jin Shen. Ashley Mokaya. Lillian Tubbs. Ju Ting Tiffany Shang. Danielle Kim. Yining Sun. Carson Smith. Ji Hoon Moon. Harris Wallace. Montserrat Diaz. Avery Clark. Catherine Shee. Jasmine Lopez. Joanna Gomez Vizcaino. Andre Haddad. Gabriel Sutanto. Sophia McHenry. Radhika Mehta. Yan Xiao. Yuzhu Wu. Catherine Soon. Ryan Koppler. Marlena Entna. Harika Parimi.
This is, we're switching to PhD. You're in PhD.
Min An Win. Jasmine Jones. Claire French. Janet Ane Magana Vaquero. Johnny Cal. Jesse Palafox Arceo. Evelyn Sen. Jing Ya Shu. Asal Al-Dijali. Kyla Rain Valdez Garcia. Valentino Vargas. Erika Matsuda. Kathy Ingo. Ruby Bennett. Ruwaida Godana. Inyanyezi Namwali. Mia Elizabeth Fu Ann Carter. Jacqueline Gooden. Lakshmi Tanushree Konakala. Mia Roberts. Trisha Venkatasan. Annie Din. Ken Vu. Arika Chin. Lana Ho. Salina Doe.
I was going to say, do you want us to talk? Okay. Or should I just go on? We were thinking that I don't have to trade off.
Those are the graduates from the Food Systems Nutrition and Health program. And now I call on Dr. Barbara Baccaro, Director of the Undergraduate Public Health Global Health major, to recognize the graduates receiving a bachelor's degree.
Cam Horn. Matthew Gesese. Ariana Fiol. Riley Sack. Bayan Ayub Zadeh Bartos. Andrea Eubanks. Sidhi Shukla. Nicholas Stoenko. Q Min Wen. Cora Kashmir. Naomi Guantes. Hannah Huang Tru Nguyen. Jocelyn Bao V. Nguyen. Brian Fabian. Leah Matthew. Eden Fenta. I know. Salam Warku. Kayla Kaney. I know. Charlotte Greenstone. Patrick Hong. Kira Nguyen. Stacy Hell. Husu Zhang. Violet Glennie Parks. Hato Tatri. Olivia Yoon. Mehek Bawa. Ethan Dickerson. Tatum Byrne. Kadesti Kide. Kenta Huanka. Veronica Rivera. Duve Diaz. Joshua Rhines. Anna Deep. Madeline Pickens. Yulisa Chavez Sija. Alejandra Tolentino. Kimberly Lafave. Sandra Ramirez Ramos. Sarahi Agundis. Maylin Aguilar. Masha Ostap. Julissa Diaz Magana. Jared Estrada Bernal. Stephanie Vasquez Pedro. Ashley Nevares Hernandez. Electra Linga. Cindy Shu. Ashley Simon. Pia Vamola. Tamsin Samonte. Shay Wyatt. Jane Jones. Erica Fosberg. Gali Celaya Martinez. Jocelyn Kaur. Cara Muguanya Rodriguez. Sarah Amateur. Vanessa Garnica. Rosario Fernandez Santiago. Emily Tran.
Alejandra Tlapetco Acevedo. Close. Halima Salim. Ishal Shah. Amel Rai. Alice Zdrobrovsky. Annabelle Siddons. Rebecca Leopold. Ariel Rave. Amelia Laffer. Sierra Burrow. Oceana Aguirre. Madeline Sid. Lucia Jang. Thomas Matthews. Zunair Shafakat. Ellery Shostalo. Junxuan Chen. Joey Wu. Jillian Wang. Nila Chandramauli. Nita Han. Hermone Getnet. Aliza Kadri. Samrawat Michael Gabriesus. Vanessa Kankam. Tiba Hashim. Alberto Ariola. Christian Cabrera. Mark Manuel. London Wynn. Cordelia Plymale. Kim Wynn. Elijah Rainey Gibson. I should slow down. Jocelyn Carr. Even Kim. Nicole Chen. Heidi Nguyen. Sharon O. Yasmin Saeed Aden. Amal Mohammed. Sharif Hassan. Helena Kobayashi. Julia Masterson. Isabella Sonko. Bhavya Nandikanti. Kayla Mukesh Patel. Marjan Fathi. Harshini Narayanan. Ria Misra. Gauri Madhu. Yana Danielian. Maisie Rahill. Olivia Rona. Nika Tampulo. Lana Vong. Virginia Murathi. Adriana Scott. Michaela Mixon. Christy Nguyen Doan. Madison Bennett. Sanskriti Kulkarni. Madison Ann Shea. Athena Otto Van Oskervold. Twangvi Nguyen. Joshua Cho. Febily Abela. Zoe Bischoff. Camille Randall. Malene Dillon. Hannah Sugihara. Sugihara, sorry. Sorry, that was a bad one. Leanne Quach. Shreya Mundra. Isha Sharma. Martin Nguyen. Matthew Choi. Tu Nguyen. Carson Kita. Tiffany Chen. Avery Liu. Grace Kang. Mia Ellsbury. Eliza Smith. Sadiqa Kesatri. Jennifer Benitez Vaya. Jeannie Yoon. Bree Canless. Annika Lee. Abby Doan. Jenna Yamane. Emma Chung. Lena Albadawi. Catherine Jane. Sophia Lozano. Aya Abdel Kader. Aliyah Maldonado. Angel Cuevas. Megan Nguyen. Elena Lamb. Kaylin Soriano. Tariana Michelle Williams. Jordan Heiser. Linda Wang. Annie Schwartz. Allison Chua. Victoria Torres. Michelle Echeverria Aguilar. Angelique Nguyen. Carolyn Slack. Chaitna Dashmukh. Ria Nandi. Daphne Suen. Jocelyn Ann Domingo Punganimban.
Where have you been?
Myra Menon. Marina Olyacha.
Congratulations.
Lexi Fan. Trina Lee. Sophia Friedel. Hathaway Bush. Kate Morris Wolf. Leah James Ricks. Catherine Baum. Jolene Van. Yulissa Solorzano Reyes. Fionn Mabele. Sophia Shui. Talia Hess. Wint. You don't want your last name? I know, you didn't. Lacdow. Sorry. Marita Prentice. Charlotte Wolfert. Riley Lanahan. Leah Jamaluddin. Nyla Hassan. Rachel Burr. Sarah Wilcock. Rachel Rabinowitz. Gabby Schwartz. Lauren Forga. Andrea Nunez Silva. Emily Zinter. Ashvika Budhri Raja. Sorry. Mila Berenger. Aiden Maynard. Genevieve Wynn. Ariana Angelico Melchor Abalas. Kanushri Narendran. Leah Mulu. Jessica Toronis. Alice Groza. Ayla Kanau. Naya Birchall Norman. Michelle Lee. Jason Wynn. Celie Forrester. Solveig Smith. Alexia Mendoza. Ava Day. Maya Alohi Lani. Encarnacio Gonzalez. Mia Platoni. Sarah Pay. Sophia Frank.
Alden Gu. Mantaj Randwaha. Congratulations. Silas Healy. Filomeno Paez. Congratulations. Gala Arkova. Sorry. Ray Vardaro. Paola Joaquin. Maya Acefa. Congratulations. Elisa Wilkins. Angita Aulia. Ella Marie Reynan. Claire Lee. Congratulations. Emma Wu.
Thank you.
Ash Fenner. Alea Hofschneider Santos. Isabella Spencer. Victoria Gornia. Malin Gasca. Ataya Chivuosot. Oh my gosh. Taya Chivuosot. Oh my God, already? Deanna Brennan. Anna Shao. Zeneb Kahil. Rena Lay. Priscilla Awara Afua Hagen. Asia Renee Doty. Isan El Yacobi. Mariam Jabi. Allison Millis. Aji Cole. Hannah Bangura. Ernest Balezi. Anissa Faye. Sophie Walker. Catherine Vu. Kausar Abukar. Okay. Alyssa Ashley Valdez Rodriguez. Julie Martinez. Elizabeth Pollock. Tima Ali. Carolyn Shi. Vishya Adipudi. Tabitha Usiwe. Edna Kimuya.
You might know what I'm going to say right now. And that is, those were the graduates from the Public Health Global Health major.
Graduating students, as you are able, please rise for more applause. The graduating students we celebrate today are all completing a chapter in their education and their lives. Some are earning their first degree in higher education. Others are completing a degree that prepares them for practice or research careers. while others are completing doctoral degrees that have required many years of work and dedication. To the students assembled here, each of you has faced challenges along the way. Each of you has faced those challenges, grown stronger, and persevered. We are extraordinarily proud of you. Today, you should celebrate with your family, friends, and supporters, and celebrate your amazing achievements. We are thrilled that you have chosen a career in one of the many fields of public health represented by the programs and departments you've seen on stage today. Today marks the beginning of the next phase of your life, and we celebrate the adventures that await you. You have chosen the noble path of working for the health of communities and inherit the great tradition of those who came before you. As you celebrate your graduation today, remember that you're poised to be a change maker and joining a community of amazing individuals committed to using their skills and expertise to make the world a better place. We can't wait to see what you will do. We hope that you will stay connected. You are always invited and encouraged to come back for visits and events. We also hope you will continue to follow and share the stories of how our UW public health community improves the world. Class of 2026, the newest members of the public health community, congratulations. Those who have gone before you, your teachers, mentors, parents, and colleagues, welcome you to our community. We wish you amazing, transformative lives and adventures filled with inspiration, hard work, equanimity, and joy.
Honored guests, what an amazing day of celebration. Today's graduation required considerable planning and coordination. Please join me in thanking our wonderful staff and the many volunteers who made today's program possible. And now, as we prepare for recession, guests, we ask that you remain seated as our dean's party, faculty, and graduating students depart the hall. You'll be able to reconnect with your graduate when you and they exit the building. And now, Dean Godwin, will you please lead those seated on the stage in the recessional? Graduating student, well, you're ready, Rise. Okay.